Hi everyone, it's Jane RVN and here with some more OSCE tips. This time you're going to be drawing up an injection. I'll do the calculations and administering in another video to keep them nice and short because there's quite a lot in this one and the steps aren't always that much of a guide. So you've got all your equipment here ready to go. So I've got a sharp spin, I have got a waste bin for my syringes, I've got a choice of 2 medications, I've got surgical spirit, I've got cotton wool, I've got forceps for safe needle handling, I've got a choice of needles and a choice of syringes. So you're going to be given a scenario saying an animal needs this medication of this strength and a calculation. So the biggie that you want to be thinking about when you're looking at medication is you've got 4 things to look at. I've drawn them on here as a little guide, but I'll tell you what they are. I like to think of it quickly as DEBs. 4 things you're looking for. The drug name, is it the right name? The expiry date, so did it expire after you're going to use it, which is always good. You're always going to look for the broach date because you're going to be given one. It should be within 28 days. And then you also want the drug strength because you could be given 2 of these and they might be, say, antibiotics with 2 different strengths. So you want to be able to show that you can take written information and you can use that to give correctly what the animal needs. You're also going to need to make sure, once you've done that, that you need to invert it and shake it. At the moment this is in quite a few of the tasks, whether it's an antibiotic or not, but obviously we'd know in practice you'd be shaking it for something like an antibiotic that's in a suspension that needs to be remixed. What you also need to do is clean the top. So surgical spirit, cotton wool, top is cleaned, and you can do that before or after you shake, that's absolutely fine. So you've selected the correct drug, you've looked at your 4 points, you've got your drug, your expiry date, you've got your broach date and you've got the right strength. Then you need to select your needle and syringe. So I'm going to go, to make it quick for you guys, I'm going to go for a 1 ml syringe, and that's going to be a small amount. Needle size people get worried about. So you'd be advised for a subcut injection or an IM horse injection, you're going to go yellow or green, so a bigger needle. For an IM injection on a dog or cat, I'd be looking at blue or orange. So that's it. You are very unlikely to fail on needle choice because we know that that is subjective and there's evidence for both camps. If you talk about what to take blood from a cat from, which is obviously in a lab task, which we'll do later, you get the choice of a blue or green, and the camp is split 50-50 as to what's the best. So this one, you're likely to fail in needle size, but follow that, as I said, as a general rule. You want to make this up in a sterile fashion. So a sterile fashion is not popping it through the paper at the back. It is opening it with the tabs that it was designed for. And what I would do is open it, hold the non-giving end in, and then you can keep that until your needle is ready. Do exactly the same with the needle. You are not popping it through here, you're opening it with a fold. And then you can hold the needle cap, pick this up, and you have this, and it's sterile. And it's together. You've already checked your DEBs, turn it up, you've already wiped with swab. I'm going to draw up point 1 to make it nice and quick, and as you can see I've put in coloured water, and that's a good thing to practice with if you're worried. I'm taking it out, and we need to change the needle. We know that needles get blunt, so you're going to have to draw back because you do not want anything in the hub, so you can see the colour change, draw it back. And then safe ways of getting rid of a needle, you do not go back with your bare hand to a naked needle. You cannot do that. You can handle the needle when it's got its safety cap on with hands, that's fine. This, you've got a couple of different options. Some people do actually put it in the sharp spin. I find that a bit, frankly, gross because you've got lots of dried blood and old medicines in there. Not great. You can potentially scoop this around the table. So I'll get that in shot. So you could do that, but if you're shaking in the exam, do you know what, I would probably poke the table. You can put this back into a foam block and then pull. Other option, forceps. You can get a little pair of forceps, about £3 on eBay, buy them through work, keep them in your pocket, use them at work so that when you're in the exam this is a natural thing. Get rid in sharps. Have this here. If you're worried about your hand shaking, open the needle and do exactly the same as you did with the syringe. So open the needle and have it sitting ready to go. Pick up. That is safe handling. So this is not a naked needle. I can do what I like. And I've drawn up point 1, and I would give that to the examiner